Hey, I'm here with Dr. Lesley Williams. She's the Director of Medical Services here at Remuda Ranch, and you might have seen her in some clips, and if you didn't, you might want to check them out. We did several questions with Dr. Williams on minorities and eating disorders, and we're going to talk about that in this particular segment. So, one of the things you've done in these other questions is talk about, let's start with African American. There's stereotypes that African American women don't struggle with eating disorders, that black men like big bottoms, and so everything should be fine and you should never worry about how your body looks. What's the reality of that?
I think the reality is that eating disorders do affect African American women, and especially those that are in the middle and upper class are constantly trying to really work against some of these ideas that what a stereotypical African American woman is supposed to look like, and oftentimes maybe even going against some of those stereotypical images and really trying to model their bodies and their behavior more after their white counterparts. And so if you were to poll women within that particular sect, you'll find that their body image distress is just as much as their other counterparts. I think that some of the misconceptions in the past might have come from what sect of women were polled when they asked questions in terms of eating disorders. So I think if you were to go into, for instance, an inner city with a very high African American population, that you will probably find that women are happier with their bodies at higher weights, just because that's more accepted within that culture, within that kind of separate culture within the entire African American culture. But if you were to poll women that are mainly, college educated, professional women, and ask them about their body image distress, you'll get very, very different numbers. And I think one of the great research studies that was done was when they polled women that read Glamour versus women that read Essence. And they're typical in terms of their demographic, but it was African American versus Caucasian women within that same demographic. And in that study, they actually found that the eating disorder behaviors were higher within the African American women that read Essence.
They read Essence, not Glamour. Well, why would that be?
Well, when you think of the women that read Essence, again, they tend to be very high achieving, very professional African American women. So when you're looking specifically at that sect, you're going to find that a higher number of them will, because often these are women that came from a varied background. Oftentimes they grew up in the suburbs where maybe they were one of only a few African American women within their particular school. And so they spent a lot of time trying to kind of look like their white counterparts and change their bodies and not being comfortable with how their bodies may be just naturally. And so it would kind of stand to reason that that particular section of African American women may have even higher body image distress.
Can I ask you a real personal question?
You can.
Okay. So you grew up African American in a white culture.
Yes.
And of course, you're a doctor, so
Yes.
you moved into that world, right? How were body image issues for you as a teenager? Was it something you thought about or not really?
It was definitely something that I thought about. I think because of the culture that I grew up in, my body was not really well accepted. It was kind of different, and so I remember that there were certain things about my curves that I just didn't feel comfortable with. As I became a teenager and I started to encounter more African American boys and girls, all of a sudden they were telling me that those things were good.
Oh, okay.
It was good to have curves. And I don't think I 100% believed them, because I had spent my whole life up to that point trying to do whatever I could to get rid of them. But that was the first time I think that my eyes were open to the idea that this was a positive versus a negative.
Is it a hard line to balance? Like, do you find yourself sometimes, feeling like, well, maybe I should change, and then other times, no, this is who I am. Are you like every woman, I guess?
Yes, I was going to say, I think every woman
has that struggle.
Every woman struggles with that in terms of, that this is the way God made me and I'm happy with my body just the way it is. And then, you kind of look in the mirror and tend to nitpick a little bit, like, well, if I could just change this, that, or the other. But I think that every woman struggles with that. I think that for African American women specifically, that the line that they'll cross is they may be around some of their white counterparts and feel very out of place, maybe larger than other people, even though when they go within their families or within their African American culture, they're normal weight or maybe even underweight compared to some other people around them. So I think that that becomes a fine balance where they might lose weight and feel better in one particular setting, but then get kind of ridiculed and chastised in another.
I think then that comes down to us knowing who we are, like, and not looking to everyone else for the cues, which I think is a hard thing to do, but eventually the goal. Well, there are a number of other questions that Dr. Williams has answered that you can look specifically at. Do African Americans have eating disorders? What are some of the reasons why they don't necessarily talk about them as much? She's talking about a lot of those things. So if you look in that search box, you can search by either Dr. Williams' name or you can search by minorities, and you'll find a lot of those. But thank you for your time. I think we could spend an hour talking about it, and it would make for interesting discussion. But we'll catch you guys in another clip.
Thanks.